Community conversations have gathered a large amount of data about parents' experiences of having a child and raising them in Lewisham. Our findings show that having a baby and raising a child has a powerful effect on families, sometimes overwhelming and filled with positive and negative experiences. Families were eager to talk about this. Antenatal services for most began with visits to the GP surgery and contact with health professionals. Some parents had access to a wide range of information, advice and support. However, some reported that they felt they had little support. Language barriers and cultural differences were identified as a challenge. Parents said they needed services to support them more widely, providing a network of community support. Parents reported that antenatal services seemed to focus on the medical aspects of the pregnancy and birth. It was felt that there are missed opportunities to create more personal support through informal networks linked to community provision. Families would like to receive information and support on services available, including such things as language classes before the birth of their baby. Parents said they would like to have been more prepared for the realities of childbirth and bringing up a child. Having information and being prepared for breastfeeding, sleep deprivation, mood swings and postnatal depression, as well as the stresses and strains on the couple's relationship, should be something explored in the antenatal process. Parents also recognise the importance of engaging fathers in this process, recognising that they should be viewed as a provider of key support for the mother and baby and not external to the process. Parents also felt that when they did not fit into the expectations of health services, such as not choosing to or being able to breastfeed, they should not be made to feel guilty. Many reported that earlier information and discussion of feeding through pregnancy would be beneficial. Antenatal classes were welcomed. Women felt that they should be available in the earlier stages of pregnancy. Also, they felt there should be opportunities for antenatal classes offered by experienced and knowledgeable parents and community staff, as well as medical professionals. It was felt that this could then offer a more holistic service. The reality of a baby arriving needs planning and preparation, and it was felt that more opportunities should be made to use the time before the birth to help prepare the mother and father. All the parents interviewed had hospital births, and the majority at Lewisham. Consistency of care through pregnancy into labour was talked about as an issue. Midwives that were seen through the pregnancy and were promised to be at the birth were often changed. Services and staff seemed under pressure. Partners were unable to stay with the mother and baby, which felt distressing. Some parents felt a lack of professional care, including staff not answering questions and being unapproachable. This all seemed worse at the weekends and at night time. The birth plan was often not acknowledged, and this was felt to be a waste of time and effort to create if it was not carried out. Parents felt that these early experiences all have an effect on early parenthood, such as bonding, breastfeeding, nutrition, and other important factors. Many mothers talked about a lack of practical breastfeeding support available on the ward when the baby is born. Also, they told us about establishing breastfeeding is very difficult when the baby is in intensive care, especially if the mother has had a cesarean. The mother and baby are separated. The intensive care unit is a distance from the ward and nobody can help take the mother to her baby and support feeding. Skin-to-skin contact was not supported for some mothers directly after birth. Parents reflected that there needs to be more support on the ward, both medical and non-medical staff as well as community volunteers. This would enable a better start for many parents. Parents talked about the importance of building relationships with services before the birth of the family. Parents who had had home visits from a health visitor or midwife after the birth found them reassuring and helpful. Parents felt that you need face-to-face contact at home to pick up on difficulties and anxieties, and link parents into community support, as being at home can be very isolating. At the same time, getting out of the home can be a big challenge, especially if you don't have family around. Parents attending baby cafes and children's centre groups found them a valuable source of support and advice and a chance to link up with other parents. An easy to understand and integrated journey through the services would be helpful for parents. Services can feel disconnected and staff work in isolation from their colleagues. Often parents have had to find out about and navigate the services themselves. Parents told us that they needed good, reliable, up-to-date information about options and choices, what services are available, where they are, when they are open, what they are for, who they are for, and how to access them. Information needs to be accessible and in a variety of formats. Services and information should be taken to where people go and build relationships with everyone in the community. Outreach should include places like the mosque, church, parks and outdoor spaces, McDonald's, Sainsbury's, local shops and supermarkets. There is a need to talk to the community and not expect them to find you. First contact with a mother and father is crucial. Staff should be friendly, welcoming, non-judgmental and listen to the person and their needs first before paperwork is completed. Parents valued their interaction with staff in all settings where they were non-judgmental, caring, kind and knowledgeable. They appreciated when staff gave them advice based on fact and where it's respectful of people's choices and sensitive to family, culture and circumstances. Services could be organised more around the needs of mothers, fathers, carers, babies and children rather than around the needs of the services themselves. Groups and activities run mostly in the mornings and after lunch, but many babies sleep in the afternoon. Very few activities are at twilight, 3:30 to 4 p.m, or in the evenings, weekends and school holidays. Services are often organised around ages of children, but many families have children with siblings of different ages. Families want to be able to take all their children to these, especially if this is after school and during holidays or weekends. What we are presenting today is purely a summary of the findings from a huge amount of conversations that we have had with the people of Bellingham, Downham, Eveling and New Cross in an ongoing process. We would love to bring all of the families into the room with us to give you a sense of the richness of the data and the opportunities for giving everyone a better start.